So your brain's job is to prepare you for the environment that you're around, especially in that early phase. And if you're in an environment where you can't trust a lot of people, where you feel like your brain kind of always interprets that you're at risk, that there's dangers constantly around you because of the trauma that you've been exposed to, your brain is going to try to make some adjustments to try to protect you. And sometimes those adjustments, they serve their purpose in some instances, but in other instances, they kind of cause you to have behaviors that are considered delinquent or problematic. And if the systems around the kids don't understand how to respond to those behaviors, then I think we get poor outcomes across systems. We really need to expand our expertise and use that kind of core training that we got as pediatricians to help others understand the developmental needs of kids, to help others understand the science of toxic stress and the science of childhood adversity, to help others understand the science behind adolescent brain development. And not only understand the science, but to translate that into policy. So how can we take all that science and better inform our education system, our juvenile justice system, our foster care system? And I think you and I have both tried to learn how to pursue opportunities to expand our expertise to be able to do that.
It's almost like we have this opportunity, right? Because we have our foot in the door of the clinical world, right? And so you have that ability to speak to the clinical piece of this, because our communities are siloed, our agencies and organizations, I hate to use that word because it's cliche, but it's true, right? The different funding streams that come in and everybody seems to be competing for the same crumb, right? And it's like we're fighting each other for caring for the same kid, right? But like if we took that coin, that stack of coins, and we mobilized it, shared it with our educational system, right? Shared it with our parent support programs, the early childhood programs, to make those more quality and effective. What can we do for families? And so, I think we don't have control over it, but I think just, having a seat at the table and being able to speak to the importance of it, I think it gives us that opportunity to really have significant impact. And so, in Philadelphia, just talking to a lot of the policy leaders, a lot of the leaders in the healthcare institutions there about how we're slowly moving towards this sort of more population health approach, right? Where you are assigned a group of patients and your reimbursement rates are all dependent upon their outcomes, right? And if their outcomes are all determined not by like whether or not you have a clinic and whether or not you have vaccinations or other healthcare related services, but they're really determined by whether or not they have access to food, whether or not they have walkable neighborhoods, whether or not they have safe schools and safe playgrounds, right? Then that really gets healthcare organizations and other organizations to start to move the dollars, right, to address what we really know influences health.
Absolutely. And I think another thing that you mentioned that really resonated with me is we have to recognize that these systems, these organizations, these institutions have been in place for a long time, right? And so for a long time, the healthcare system really hasn't met the needs of Black children, of Black communities, especially those who are especially marginalized, whether it's economically or otherwise. And I think we have to recognize, one, that we as a healthcare system and other institutions and organizations, we have to do something differently. We have to change our approach. We also have to understand the harm that we have caused by not doing this work.